An area a lot of people struggle with is the under eyes. They come in asking about what to do with darkness, with hollowing, with pigmentation, large variety of things, and there is no good answer to fix people's under eye 100%. So we like to split it up into different topics. I myself, when I treat my own under eyes, well, I don't. So people ask me all the time, what do you do for your own under eyes? I'm not someone who looks in the mirror very much. I'm a very bad self-plastic surgeon, so I let it go, and I do have hollows, and I see it every once in a while. And what I do very simply is if I'm gonna take a photo by myself, I can go back just a little bit like this, bring the lens up. That gravity changes the way the fat bags sit, and your eyes get lighter that way. So that's what I do. But what I advise my patients to do is I separate it into 5 different causes of under eye darkness, and then I separate into 3 different categories of what you can do. The 5 different types of under eye darkness in general are hyperpigmentation or hyperchromia, that's color changes that happen in the skin. There's actually translucency that you see, meaning the skin gets thinner as you go medially here, and you see more brown or redness under the skin medially as the skin of the eye gets thinner. You have fat bags that can form with hollowing underneath over time, and you can have water retention that happens over time, giving you 2 types of bags. One is directly under the eye, the other is on the side, which we call malar edema. And the last one is the accordion effect, which means that the skin actually contracts over time medially and gets a little darker in that region as well. Splitting it up for our non-invasive types of things, I have creams and preventative stuff that we use, and then we have fillers, Botox, and that realm of things. There are no magic creams that work. We tend to look at the eye and see if it's got pigment. We prescribe usually kojic acid with a little beta-methasone or something that can lighten the skin, and then we switch them over to a basic hydrators type of moisturizer. Lots of pharmacists can mix in things called phytons, which tend to make the eye look a little bit brighter. Other than that, you find your favorite eye cream and you stick with it. I would advise against using Retin-A for most patients. On the under eye, it tends to cause redness and more irritation over time. Looking in the middle section, we have the non-invasive or injectables. Doing Botox in the under eye over here does not help very much. There are rare cases where it helps, so we stick usually to fillers. Fillers, the ones that we want to use are hyaluronic acid fillers. I use Restylane L, that's the safest one, I believe, short-term and long-term. I use a cannula. Cannula helps you place it right onto the bone, into the SOOF, which is a suborbicularis oculi fat, and you can volumize that area to pop it out. What you can't do is fix malar edema like that or a malar bag, and you can't fix a very big fat pad. So it's really for specific people, and you want to use small amounts over time. Fillers can also cause darkness. So there are patients that come back 4 years later, 5 years later after getting filler, and they have a little bit of darkness there. They think it's hollowing, but I see it, and to me it looks like water or glare, and that could be from filler coming up superficially, and it causes anywhere from a gray, green to blue discoloration in the under eye, and it's a little boggy. If that happens, that needs to be dissolved. So sometimes dissolver is actually the way to go to get you back to your baseline. The last is surgery. Surgery has changed a lot. There are 2 types of surgery in my book. The old school stuff, which is fat reduction and just removing skin, we don't do anymore. It changes the eye in negative ways, makes you look older eventually, and makes the lower eyelid look taller. To keep the eyelid compact and to make the lid cheek junction look smooth, we like to do something called fat repositioning. Fat repositioning means we take the fat bags that are there and put them down into the hollow. That is probably the way I do 90% of my lower eyelid blepharoplasty cases. The way I do it is to go from inside the eye, make a little incision, take the fat, put it down. It's much safer than going from outside the eye. Alternatively, I do like to remove skin on some patients where I make an incision under the eyelid and can take a little bit of excess skin. That only treats skin excess though, not skin quality. Most patients have trouble with skin quality, meaning they have wrinkles within the skin or lines within the skin. Removing skin is not going to help that in itself. I like to perform a chemical peel or a CO2 laser. A TCA peel of about 35% can go a lot farther than a CO2 laser, so I just pick and choose depending on the patient and how they look. Alternatively, if the eyelid is rounded or relaxed, I can tighten it, and tightening it back up with something called a canthopexy can help as well. There are a lot more options than that, but those are the most common ones. Overall, with the lower eyelid, you got to realize it's a very, very sensitive, fickle area. You have to go to a specialist for any of these things. For the non-surgical, I think dermatologists in general do a great job helping with the skin quality, texture, coloration, and certainly with injectables as well. For the lower eyelid surgery, it's very different than upper eyelid surgery. I would seek out someone who is very well trained in lower eyelid surgery or an oculoplastic surgeon.